Hey guys, it's Dr. Abraham with A Simple Aesthetics, and today in this episode we're going to be talking about men and aesthetics. So some of the most common treatments they're done, what to expect, how it's a little bit different. I think it's a great episode if you're a man and you're watching, but also a lot of females I think will find this interesting, especially if you have, a husband or a boyfriend or somebody that you kind of want to talk to them about the field, but you're not sure exactly how to approach it. And to help me with this episode, we have the amazing Lindsey with us. Thanks for coming back.
Thank you. So happy to be here. And I love this topic because it's so interesting. When the wife drags the husband in, they're usually not interested and it's like pulling teeth. But when the man has decided on their own that they're coming in, they are my absolute favorite patients. They're just so trusting, so, open to ideas, and they're so fun to work with. So I love treating men in the office, which is much more rare than treating women as of now.
Sometimes the first treatment for a man is the hardest one to kind of get across that, but once they do it, I've also seen them too where they're dragging them to the office, but they secretly want to be here. The man, they're just kind of pretending like, oh, I don't want to be here, but I'm just doing it for her. But they want to be there.
Yep.
So yeah, I think it's actually a growing field. I think aesthetics is definitely also for men. It's not just for females. There's a little bit more stigma when it comes to certain treatments, I think, with men. But I do feel like these barriers are not there as much anymore, and we see a lot more men come in for treatments. And again, most of the men who come in, they're very happy and they come back over and over and over. But the approach can be a little bit different when when we're treating a male versus a female, and we can kind of dive in a little bit deeper into that, if that's okay.
Yes, absolutely. Yeah, like a lot of times I'll see a male initially for something like laser hair removal. That's a common thing to kind of like thin an area down or, try to remove it. But that sometimes is a popular treatment. A lot of men come in to do Botox, and really they have to see a good injector who knows kind of how to approach the male patient, because sometimes they require different dosing, their muscles work a little bit differently or are stronger, and also they don't want to kind of typically have like such a shiny appearance to the face or look obvious. They just want to soften lines in the face. So when I do Botox, I usually treat them properly, but will still allow for movement so that they don't feel totally frozen.
Well, my question was going to be, what's the most common treatment that you see men doing, outside of lasers? Is it Botox, since you're talking
Yeah,
about that?
probably Botox. Recently, I have had a big influx of men coming in interested in hair restoration. That's a common one. And treatments like NAD therapy or even vitamin therapy, B12 shots. But NAD has been really popular, and there's a lot of buzz about that on social media. There's a lot of supplements that are being, advertised all over the place. And NAD, really, if you get a proper like therapeutic dose of it, which typically you have to come into a medical office for proper dosing or injections of NAD. Men can kind of regulate testosterone levels. They can lean their bodies out, build muscle, get energy. And there's so many benefits to NAD that I've seen that guys are really happy about.
Yeah. And I think we kind of alluded to this a little bit in the previous episode, but some of the treatments that you're talking about, over here, we're more of an anti-aging and aesthetics kind of thing. So that's why some of the treatments you might not find in a typical, aesthetics only place. Things like the NAD or IV or, some of even the hair rejuvenation treatments. But definitely also, from the same background where I also do a lot of anti-aging treatments. So sometimes we see men who come in initially for the anti-aging treatments, and then they kind of also start to do more cosmetics, things like, Botox and laser and, even fillers. We see men now, I would say, sometimes they might focus a little bit more on certain areas. So like jawline filler, for example, tends to be, a little bit more popular with men than certain other areas. So even these treatments are becoming more common, even if again the approach is a little bit different.
I love jawline filler for a man. It turns out so nice, helps give definition. If they have like kind of some skin laxity or almost like double chin, you can really sharpen up the jawbone. And that type of filler, if it's properly dosed, can last years and years and is such a nice treatment for
Yeah.
men.
Yeah.
Yep. So
No.
I love jaw filler. I've done cheek filler on men, and just kind of like rebuilding structure in the face can really be nice for a male patient. I've even done some of the biostimulators for like some skin tightening, but really they're starting to explore more and more. But what have you done, Dr. Adam?
Yeah. Like personally or
Yeah.
clients? I've done a few things. Botox
You
for
name
sure,
it.
Sculptra, which is a biostimulant, as you've mentioned, I've done. I think also like when you understand the difference, kind of the different facial features between a female and male, that allows you to kind of approach the client a little bit differently, which is why you might choose slightly different treatments, or even if it's the same treatment, you would do it kind of a little bit differently on a patient. I was gonna say I haven't done anything personally, but I think we did an episode where I was just kind of talking about how I was recovering from Botox, so I won't be able
Botox,
to say that I haven't done
Sculptra,
anything.
filler.
I've done a touch of fillers before, yeah, yeah, absolutely. I've also done laser hair removal.
Oh yeah,
For
how did
most.
that go?
It was painful. It
Yeah.
was painful. I do have a low pain tolerance, I would say. So
Yeah, guys
everything
tend to
there is.
be like the babiest of them all. But also I feel for them because especially laser hair, sometimes they have dense, thick hairs and you know that it's got to be so painful. They get
Yeah.
so red and sometimes like they have little bits of swelling afterwards, and I often am apologizing throughout those treatments.
But I gotta say, it was worth it though. It was
Okay.
definitely worth it for me. And I'm a little bit of a baby, but with the numbing cream and stuff, it can really really help
Uh-huh.
for sure.
Yeah, like my husband, for example, I've done micro needling on him. I thought he was gonna die, pass out, but then other things he does perfectly fine with, like a laser treatment, CO2 laser I've done on him. Actually, I just did a CO2 on my husband, and he didn't really know what he signed up for. He just showed up and he thought he was getting a facial, but I did CO2 laser
Trust
on
over
him,
there.
and he is so happy. And he's also recruited like so many people from his gym because he showed up to the gym the next day like super red and kind of swollen, and everybody asked him what he did and he was so open. He's like, CO2 laser, and let me tell you about it. And since then I've seen like 3 or 4 people from his gym, men and women, so
Yeah.
he's kind of like a walking advertisement. So I mean, I kind of initiate the treatments on him. And then I've treated family members, male friends, but do you find that you like talk about these treatments, or your friends kind of do them because they know that you are skilled in this field?
Yeah, I definitely have a lot of friends who do it. It actually comes two ways. There's like some friends who, kind of do it because they know me and they've kind of learned about it from me. And then I have a couple of friends who kind of like did it and always done it, but they kind of come to me on the low. They're like, hey, you do Botox, right? Because I've been doing it for years, but so they're kind of secretive about it. Which I think it comes back to the first point. I think one of the main problems or issues when it comes to men and aesthetics is that there's a little bit of lack of awareness. Like a lot of men think it's just not for them, or they don't really understand it. They just kind of, oh, like this is not, this is only for females, and that's so not true. But I think a lot of men, once they actually kind of are more aware of what's going on in the field and what options they have, they end up, because everybody wants to look, healthier,
Yes.
younger, more youthful, more balanced, more lifted. So most people, once they're aware, they are much more open to do it.
Yes. And we're going to like see over the next couple decades, there's going to be the people that kind of were doing it, secretively or kind of here and there over time, men especially, compared to the people who didn't. And we're probably going to see this drastic difference between like preservation of their skin. Of course, there's the people that go overboard, and unfortunately, you see that out in the wild. But the majority of people who do this, you would never know. You just appreciate kind of their features, or you think they look handsome, or you think that they have, you know, good genetics, but they've really been doing some things to kind of help themselves along the way.
I would highly recommend it, honestly. I always highly recommend it to my male friends and stuff. At least go and get a consultation. See, you know, get an opinion from somebody who's an expert. You know, see what you can do. You know, a lot of men do have something about their face that it kind of bothers them, or they don't like it, but they just for whatever reason, I guess like maybe lack of awareness, they never thought that, oh, hey, I can go and treat that and make it better. But there's a lot of men who don't like, you know, their skin complexion, and they want, you know, a treatment like a CO2 or something can help them. There's a lot of men who don't like the hollowness under their eye, or they don't like the lines in the forehead, or the deep lines in between the eyebrows. But again, it just kind of like never crosses their mind for whatever reason that they can treat that. But once it does, and they're like, oh yeah, let me do that, sign me up for that. And then they're very happy with the treatment. And again, some of the male clients I have are some of the kind of like most compliant, the ones who come back on time, you know, every appointment.
100%.
Yeah. So
They're right on schedule. They book their next appointment before they leave. They're like the best patients. And I believe there are going to be some like spas in the future that cater specifically to men, because it might be a little more comfortable for them to go in, or they feel like they can go or talk about it with their friend, and it's not like this kind of image of like this beautiful, pretty kind of office that seems very girly. And so we'll see what happens, but that might be the next big thing.
Yeah, and a lot more like med spas and, you know, clinics are now a little bit more kind of integrated in terms of kind of like catering to both sexes. Well, I hope you guys enjoyed this episode. Make sure you like and subscribe. Thank you, Lindsey, for coming back.
Thank you. So fun. I love this topic.
Always fun to have a conversation with you. We'll see you guys next week.